हेलो, आई एम अंजलि शर्मा, आई एम फ्रॉम द्वारका मऊ। मेरा पहले सर्जरी हुआ था कैंसर का, और जिसकी विद इन 2 or 3 months मुझे इंसीजनल हर्निया का प्रॉब्लम क्रिएट हुआ, और उससे मुझे काफ़ी प्रॉब्लम हुआ। तो सेम ईयर में मेरे को सेकंड प्रॉब्लम स्टार्ट हो गया आफ्टर कैंसर। तो उसके बाद सर्जरी कराना इम्पॉसिबल था, बट मैंने आकाश हॉस्पिटल में आके कंसल्टेशन ली। डॉक्टर निखिल अग्निहोत्री से मैंने कंसल्टेशन ली, उनको अपना सारा प्रॉब्लम बताया। तो उन्होंने मुझे लेप्रोस्कोपी सर्जरी के लिए सजेस्ट किया, और बस मैंने अपना ट्रीटमेंट स्टार्ट किया। और मेरा बिफोर 3 days मेरी सर्जरी हुई लेप्रोस्कोपी। आई एम वेरी सक्सेसफुल।
Hello everyone, myself Dr. Nikhil Agnihotri, Senior Consultant, Department of Minimal Access, Metabolic and Bariatric Surgery, Aakash Super Specialty Hospital, Dwarka, Delhi. So today we'll be discussing about incisional hernias. So we had this 51-year-old lady, Mrs. Anjali Sharma, who presented to us with the history of exploratory laparotomy for CA endometrium, wherein open surgery exploratory laparotomy was performed, and uterus, tubes, ovaries are removed. We call that a radical hysterectomy, and along with lymph node dissection for staging of the diseases. Pelvic and para-aortic lymph nodes are dissected to stage the disease. So patient came to us with the history of this procedure, and after about 5 months of which she developed hernia. She was having swelling and pain in periumbilical region, and also had history of intestinal obstruction. Intestinal obstruction when the bowel gets entangled and gets stuck. So patient has distension of abdomen and vomitings. So after consulting us in the OPD, we ran routine tests, and sometimes we also advise ultrasound and CT based on the clinical findings. So she was taken up for a laparoscopic intraperitoneal onlay mesh repair for incisional hernia. So this incisional hernia typically develops after a previous surgery, wherein the abdominal wall is weak because of the previous scar. As evident in the picture, you can see a long scar almost from the xiphisternum up to the pubic symphysis, and multiple defects were seen intraoperatively. The contents were omentum and bowel, which is very carefully taken down so that there is no injury, especially to the bowel. Because if at all there is an injury to the bowel, then the field gets contaminated and you cannot complete the hernia surgery. You cannot push in a mesh or any other implant. So very carefully the contents were reduced, and multiple defects were seen in the scar region, right from the periumbilical region superiorly up to the xiphisternum. So we call these Swiss cheese defects, which are multiple defects. The largest one was around 4 into 4 centimeter. We are able to perform the whole procedure as well as place the required size mesh, regular or large or extra large size mesh, which was 20 into 15 centimeters in this case, large mesh. The whole procedure and mesh placement is done laparoscopically through these small ports as evident in the picture. Post-operatively, the patient is doing fine, and these patients are usually discharged on first or second post-operative day.
I'm happy, और मैं पहले से बहुत बेहतर महसूस कर रही हूँ, और मुझे अच्छा एक्सपीरियंस रहा यहाँ का। डॉक्टर्स बहुत सपोर्टिव हैं, और उन्होंने मुझे बहुत हेल्प किया, और यहाँ का जो स्टाफ है, यहाँ का जो मैनेजमेंट है, इट्स वेरी ग्रेटफुल। थैंक यू सो मच।